Hi, I'm Dr. Leila, a California board certified family and cosmetic dentist and the proud owner of Leila Hariri Clinic in Dubai. I graduated from UCSF, one of the top 5 dental schools in the world, and bring over 25 years of experience, 21 of them right here in Dubai. I've been honored with the I Love My Dentist Award twice, thanks to the trust and connection I share with my patients. My mission is to transform smiles, build lasting relationships, and make dental care something you can feel confident about. Join me as I share expert advice, stories, and insights to help you achieve the healthy, beautiful smile you deserve. Today, we're going to be talking about something that most people don't know is affecting their overall health. It's chronic dental infections. And I got the inspiration for this podcast by a book that Dr. Parviz had me read, The Roots of Disease. So join me today as Dr. Parviz, our expert in holistic healing and naturopathic medicine, will help us connect the dots between oral health and systemic health. Welcome, Dr. Parviz.
Thank you so much, and it's good to be with you. You are absolutely right. The problem is that a lot of people are not aware of the importance of the oral hygiene or oral health. I remember for many years ago, they were telling if you want to look at the tissue of a heart of a person, you could either open their chest and look at the actual heart or look at their gum. What you see here, it's very similar to what you see down there. There could be a lot of hidden sources of infection in the mouth of the people without them being aware of it. And when there is a long-term standing infectious condition in the body, whether it is in the mouth, in the gut, or anywhere else, as hidden, it is there, but that doesn't have a lot of symptoms for people to be aware of it. It becomes a long-term challenge on the immune system. And when the immune system is challenged for too long, there's going to be exhaustion, there's going to be stress on the system. And when it becomes less capable of doing what it is supposed to do, it means the microbes now could grow everywhere in our body.
Wow. So just because we don't feel pain doesn't mean that our health is up to par.
That is true.
Okay, so you can say the immune system is like a bank account.
It is exactly the same, yes, because the integrity of the immune system is a key factor to keep us protected against intrusions, against antigens. They could be microbes, they could be toxicity, they could be anything that becomes a challenge to our longevity, well-being, and health in overall.
So stress, poor diet, lack of sleep.
All of these factors are fundamental keys in determining the integrity and the quality of the immune system. When there is stress for any reason, including long-term hidden infection, there's going to be more of adrenal function within the body. That means more steroid to control the inflammation. That means less immunity and consequent problems with the long-term stress. That's one example. Yes.
So as a dentist and as patients, we often think that just because we had the root canal or the bad tooth removed, that we are now through with the infection. But now we're finding out, after all these years, more and more, that that's not the case.
That is not the case. When you talk about root canal, what happens, as you are an expert in that, is that the access of the body, including the immune system and blood supply to the root of that infected tooth, is cut off. There is no way that the body can reach that area.
Correct.
It's like a lady who is using tampon during her period. If the tampon is not changed frequently, there's going to be a septic shock coming, possibly, and it could lead to death because there's no blood vessels growing in that extra material put in the body. The same story, when the roots are cut off from access of the body through the blood vessels and everything is through the nerves, it becomes unreachable. So anything could happen there without any positive effect of the body to control that. That's the problem with root canal. So it will become a source of constant infection, constant challenge to the body, and then it brings a lot of consequences in long term, especially in people who are more susceptible, they have a weaker immune system, they have other issues to handle, more difficult lives, and so on.
So that's the key point, is it depends on your immune system. Some people may be able to really go under the radar and nothing happens to them. But we as dentists have to look now more holistically. If we see other issues in the body, we have to look and see what is the main source of that. And as a dentist, yes, it could be the mouth. and we have to look into this.
It's incredibly important, something we're missing a lot. That's true.
So being holistic. Now, for those that still opt to do root canals, there for in our clinic, for example, Dr. Parviz, thanks to you, we have ozone, we have frequency. Could you just briefly touch upon how that will help?
Okay. Ozone is antiseptic. It destroys negative or pathogenic microbes. Yeah, ozone is oxygen, so there's no side effect with that. But if you look at the concept of root canal, the microbes which used to be previously in the mouth cavity enjoying a lot of oxygen around, now they are being trapped in a small area and they become anaerobic. If you could send oxygen to that area, let's say by penetration, which is osmosis, it will definitely help to change their nature. When ozone is injected by the dentists who are trained close to the area of the dental work, it penetrates into the tissue. So you don't have to have actually blood vessels to send the oxygen to the next and next cells. It penetrates osmosis, if you remember. It changes the physiology and the pH and everything else about that particular tissue. So it's a great help. Additionally, it kills a lot of bad microbes in there. That doesn't mean that people, as you said, who have root canal, they're constantly endangered. Something will happen to them, but sometimes, most of the time, it could be very negligible. But we're talking about people with more health complications or other issues. At some point in life, the chances of them facing something more vigorous is going to be definitely more.
Absolutely. And another hidden issue is cavitations. If you can touch upon cavitations. So basically, after getting your tooth extracted, we find out, and often this is hidden in x-rays, that people have cavitations, which, the bacteria that's left in there, now, as there is no blood supply, it turns into the bad form, anaerobic. What can happen, and what can we do to help?
The same story. First of all, dentists have to be smart to do a job with the better results. That has a lot to do with the outcome of their work they do. Secondly, it's a good idea for people who have had tooth extracted in the past, but if there is any discomfort in the region or any symptom, they should have it checked by professional dentists. It's a good idea to go to a dentist and tell them what you feel about that extraction or what is happening after that. Let them check the area properly to see if there is any problem with old bacteria remaining there or not.
The problem is sometimes, Dr. Parviz, these things show up years later. For example, chronic fatigue, inflammation in the body, and then people don't relate it to, an extraction made years before.
That is true. It takes time, but any people who have, to be honest with you, when people come with chronic diseases or long-term problems to me, in many of the cases, I ask question, when was the last time you had a dentistry checkup? Or in my machines, I look at the signals, evaluation of the teeth and everything about the oral cavity. I look at the signals. Is there something that I have to pay attention to? In sensitive cases, I get a signal and I advise them, please go have it checked. It's time for you. When was the last time you were with a dentist?
Amazing.
Because, yeah,
So
the
that's
body's...
part of your initial checkup?
Yeah, of course.
Do you want to just brief us a bit more on that?
You see, quantum systems are about analyzing signals emitted or produced by a target. That's a human body. Somebody comes with certain problems. We look at the signals that are created or sent out by their system: body, emotion, mind, spirit. These are all layers of information. At the physical body, we look at the microbes, bacteria, viruses, parasite, fungi. Yeah, they all have vibrations. If vibrations are picked up by the machine, it is indicated there. If we see a vibration, doesn't mean that it's definitely there. Or if we don't see it, it doesn't mean that it's not there, because the human body receives, analyzes, and reacts to 40 billion bits of data per second. We could check maximum close to 12,000. So it's the drop from the ocean of the information, but it's good enough to show us a lot of things. So dentistry is a work that people have to pay definitely more attention to. Many people take it for granted. They see a dentist when they have a pain or a problem. That's
Correct.
too late.
Correct.
Regular checkups are very, very important, and it's also important for people to find trustworthy dentists who are who are well experienced and they take time. You know, you have to be passionate for your job to
Correct.
create a better result.
Correct. Correct.
These doctors are available everywhere. Here at the Leila Hariri, we have many of them.
Thank you so much for that. But really, we were all trained. I was trained to just take care of the dental issue. I mean, take care of it in an amazing way as humanly possible, but just the dental issue. Now we realize that we have to look at the body holistically because it's hand in hand. What is happening through the oral cavity is affecting the whole body and vice versa. And yeah, the key word these days is microbiome, Dr. Parviz. As if you can touch upon the microbiome.
Absolutely. These are different forms of microbes that are protecting our body and helping our body to survive in the best possible way, to stimulate our immune system, to improve our digestion, and so far. We start acquiring them from the moment of birth, passing through birth canal of the mother. Your body becomes fully carpeted by protective bacteria and starts from there. So children who are not being born normally, they could lack the basic protection of good bacteria or microbiome. This is number one. Number two, among these billions and maybe trillions and trillions of microbes surrounding us within and outside, occasionally some of them could become upset because of the wrong environment and become pathogenic. They start producing diseases. It's not that you have to attack them all the time with antibiotics. Antibiotics are very important, but they have to be used correctly. For long-term problems, antibiotics are not the answer, and that will change the quality of the defensive bacteria or microbes in us, because if you kill them constantly, some strands will survive, which is due to some mutation, but they can never be the original bacteria or microbe that are supposed to be there for us. So it changes everything. If you change the soil, that tree could never produce the same yield as before. The environment is changed. Yeah.
So as you always say, balance. I always come to your room and I read, balance is health.
Health is the state of balance.
Yes.
And when you say holistic, it is the body and the energy system of the body, thoughts, emotion, mind, beliefs, feelings, reactions. And within the body, mouth is really, really important. I cannot emphasize more on that.
Yes.
Not only the quality of the tissue in our mouth, but what we put in this mouth and what we allow to come out of this mouth. You see, now we're talking a better balanced life.
Correct. That well put. And really, after this conversation, I feel on my shoulders the weight that we dentists carry as our responsibility, actually, for people and their overall health. I hope this was as eye-opening for you guys as it was for me. Thank you so much, Dr.
It's a pleasure.
Parviz.
As the last sentence, I want to emphasize this one more time, that you guys are not just dentists. With the good job that you do, with the care that you give, you actually create a healthier life in future for everybody who come to see you. You save families, you save parents, you save children from unnecessary diseases or problems in future. So you have to be proud of yourself. Dentists have to pay more attention. Like every other doctors, they need to work from their heart. They need to be honest with themselves and the patients. And knowing that the job they do is not just helping them to have a nice set of teeth, or is prevention of a lot of other problems in future. So you should be proud of yourself.
Thank you so much, Dr. Parviz. And what you say is absolutely true. As dentists, we have to keep looking deeper and deeper. And to all our listeners, thank you for tuning in. Please do subscribe. And until next time, stay safe. See you next time.